Hi class, my name is Rebecca Herks, and for my career presentation I decided to do some research on a child life specialist. I didn't really know exactly what a child life specialist was, so I did some research, and they basically, a child life specialist they're pediatric healthcare professionals. They work with children and families in hospitals and other settings. They kind of help them cope with the challenges of hospitalization, illness, and disability. They provide children with age-appropriate preparation for medical procedures, pain management, coping strategies, play, and self-expression activities. They also provide information, support, and guidance to parents, siblings, and other family members. The goal of a child life specialist is to help each family cope more effectively. Because there are many physical, emotional, and cognitive stressors that accompany a hospital stay, child life specialists, they use child-centered interventions and pain management techniques to work with the patient and the family members to help them cope with the hospitalization and medical procedures. Some of the interventions that a child life specialist works with or helps they include things like encouraging the parents to be present and to participate in the care for their child, showing the parents how to participate and be involved. They talk and communicate frequently with the patients in a calm manner. They advocate for pain management strategies to prevent child discomfort or pain, providing choices when appropriate, being realistic and truthful with children and adolescents. And they provide age-appropriate activities that foster a sense of accomplishment. Some of the pain management techniques that a child life specialist practice involve music, toys, encouraging words, singing, videos, comfortable positions and places, or using humor. Some of the ways that a child life specialist helps a parent is they help them understand the diagnosis of their children. They help the parents know how to prepare their child for their healthcare visits. They address any concerns and worries the parents have about their children's health and outcome. They help plan for hospital stays, procedures, surgeries. They identify non-pharmaceutical pain management techniques. And with the young patients and their siblings, they help them by guiding them as they process the emotions they're experiencing during this time. They help them regain their sense of control that they've maybe lost. They offer expressive therapeutic outlets like art, music, and story. They use toys, dolls, and pictures to engage in therapeutic child-directed play. They also can connect parents and siblings with emotional support through their peers and other community groups. And they prepare their siblings, the siblings for visiting their brother or sister in the hospital. I had the opportunity to talk to my sister-in-law, who is a certified child life specialist, and just kind of ask her about her job and what's it like working with children in a hospital setting like that. She works in Scottsdale, Arizona at a healthcare medical center. She works in the pediatric ER, and so because of that, even though the hospital is a large organization, the child life department is small. There were only 5 child life specialists there, and her work hours are from 3 p.m. to 11:30 p.m. because she works in the ER. The other child life specialists, they work during the day, and it just kind of depends on the population and the area that you work in. She works part-time, so she only works 3 days a week. She took this job because it was friendlier to her family's current needs. She is married. She and my brother have 2 little boys, and with work for both of them and things, it works out that it works for their family that she can work part-time. And her manager is very flexible and understands the importance of family. Not all managers and departments are like that, and so she appreciates that her manager understands that in her family situation. She works on her own, so she's very independent, and she rarely sees her other child life coworkers. Some of the typical stressors that she experiences are that it is a fast-paced environment. She has to deal with seeing and working with sick and injured children and working with stressed parents. She has to also advocating for the least stressful way to treat children with providers, such as doctors and nurses. She has some health benefits. She's got health insurance, dental, and eye. She does not have retirement benefits because she only works part-time. Some of the common job tasks that she'll do in a typical work day. She prepares children for medical procedures using developmentally appropriate language and tools. She'll kind of explain to them what's going to happen during a surgery or a test or whatever. She provides emotional support and distraction for the children and the parents during procedures. So once again, she will be there while maybe blood is being taken or a test is being done or something to kind of help distract the child. And she provides bereavement support during the end-of-life situations. She provides education and support to siblings. And of course, the never-ending task of cleaning toys. Educational requirements. You have to have at least a BA or a Bachelor of Science in a child development-related field. You have to do an internship. I think hers was about 480 hours, maybe more, as I did some more research and I looked at some different websites. One of the requirements I saw was a 600-hour internship. So it may have increased a little bit since she went to school, but and you also have to take a certification exam. The most up-to-date requirements, educational requirements, can be found on childlife.org. When I asked her just to kind of what she thought of her job and how she felt about it, she said that she loves her job. She loves that her job is to help the hospital be a less stressful and scary place for kids and families. She wouldn't have stuck with it for 8 years if she didn't love it. She says she definitely has hard days, but when a child or family tells her how much they appreciated her services or how her intervention made a difference, it makes it all worth it. So it was great to talk to her about kind of, just what a child life specialist does. And I look forward to learning more about this and other careers. So thanks for listening.